how to inject the parotid with anatomical localization?
The inferior boundary of the zygomatic arch down to the anterior edge of the sternocleidomastoid muscle, and then you have it from the mastoid process to the masseter. So really kind of in here.
The gland.
It's a big gland. It's the,
Hard to
the
miss,
largest
perhaps.
gland. Submandibular lies in the inner table of the mandible, and it's really in the posterior third of the, along that. So if you go between the chin and the angle of the mandible, you'll find it in the posterior third, right up, and then the needle has to be pushed in and pushed up towards that inner table. And sublingual, we don't go after.
Right. How deep do you put the needle in for the parotid gland?
I use a half-inch needle if I'm only doing parotid, and it's not very deep, but it depends on the patient because depending on their weight, they may have a different amount of sub-Q fat, so the sub-Q layer can vary. So that's, again, where ultrasound comes. If someone's very thin, it's going to be very superficial. You don't have to go very deep, but in someone who's heavier, there may be a significant sub-Q layer that you have to get through. And then if you're too far in, you're in the buccinator. Or the carotid, potentially. And so, again, that's where ultrasound comes in to let you know what the depth is. And by the way, again, another plug for ultrasound, it's getting cheaper. It's my first machine cost about $40,000. I just bought one a few months ago, a better machine, and it's $2,000. And so if people are not comfortable with a anatomic guidance, it's a quick, easy procedure to learn, and it's now fairly affordable.
And you are offering to buy everyone an ultrasound machine.
That's right, and teach them.
In the studies, anatomical localization tended to rely on halfway between the angle of the jaw and the external meatus, and then bisecting, coming 1 finger breadth anterior, and with a single injection. Do you use a single injection or use more than 1 injection?
I know sites that use up to 9 injections. I think 2 injections is common. I'm using a single injection.
I use a single injection as well.
And I find that works well.
What are some of the side effects that you talk to patients about when you inject them to be aware that they could occur?
When I'm injecting only the parotid, the real concern is dry mouth. And what goes with that, which could be dental decay, they may have thrush from that. There is a potential, if you're blind, you could hit the facial nerve. If you're too deep, you could be down here in the carotid. But most of the injections are going to be in this area, still over the bone, where carotid and buccinator are not really coming into play. If I'm going back here, then I'm very careful to watch for the nerve, watch for the artery so that I don't hit it. So dry mouth is the big issue. For the submandibular swallowing is the problem, dysphagia. Even if you're careful and you put the toxin right in the middle of the submandibular, it doesn't necessarily stay there, and it can diffuse to other surrounding structures and cause dysphagia.
Do you involve a dentist at all? Since they're having all the saliva, it could affect their dental hygiene?
I don't, typically, but I could see dentists doing this procedure for patients as well. And certainly otolaryngologists are doing the procedure already. So I see this botulinum toxin being useful for a lot of specialties.